A recent international study has delivered a major step forward in understanding the role of lipoprotein A or LPA in cardiovascular health, offering new insights that could pave the way for better prevention and treatment strategies across global populations. Conducted by the China Kadoorie Biobank Collaborative Group and published in Circulation, the research bridges data from East Asia and Europe to show that LPA contributes similarly to heart disease and large artery stroke risk in both ancestries. This breakthrough not only strengthens the case for LPA as a universal biomarker, but also brings us closer to equitable cardiovascular care for people worldwide. For years, the focus on LPA has primarily revolved around European populations, where elevated levels were known to be a significant risk factor for atherosclerotic cardiovascular disease. What's remarkable about this new research is that it confirms these same risks apply to East Asian populations as well, despite differences in genetics, diet, and environment. By including over 18,000 individuals in China and validating findings in the UK Biobank, the study reinforces the idea that LPA should be a focus of global public health strategies, not limited to one ethnic group or region. One of the most encouraging aspects of the study is the consistency in results across different genetic backgrounds. Using a combination of direct plasma measurements and genome-wide association studies, researchers identified 29 genetic variants that significantly influence LPA levels in Chinese individuals. These findings were not only statistically robust but also replicated in other groups, showing meaningful overlap with what has already been discovered in European datasets. This type of cross-validation strengthens confidence in LPA as a risk predictor and opens the door to personalized medicine approaches tailored by ancestry. Importantly, the study found that for every 100 mol/L decrease in genetically predicted LPA, there was a substantial drop in the risk of myocardial infarction, a powerful argument for therapeutic intervention. While effects were most pronounced for heart attacks, there was also a clear link to large artery ischemic stroke, suggesting that reducing LPA could provide double protection for the heart and brain. Given how many cardiovascular events occur with little to no warning, having an actionable biomarker like LPA is a valuable tool for early risk stratification and prevention. Equally promising is what this research implies for future drug development. Until recently, LPA was considered a difficult target, largely genetic, hard to measure, and with no effective treatment options. But the emergence of these new findings adds momentum to ongoing efforts to develop therapies that specifically lower LPA. Several innovative treatments, including RNA-based drugs, are now in late-stage trials and showing early signs of promise. These therapies could eventually fill a critical gap in cardiovascular care, especially for patients whose LPA levels are high despite otherwise healthy lifestyles or controlled cholesterol. This study also adds depth to the conversation around global health equity. Cardiovascular disease remains the leading cause of death worldwide, but not all populations have had equal access to early detection tools or targeted interventions. By demonstrating that LPA is a meaningful risk factor in East Asian individuals, this research encourages a broader, more inclusive approach to screening and prevention. Health systems in Asia may now feel more empowered to incorporate LPA testing into standard care, just as some European guidelines are beginning to recommend it. Furthermore, the findings serve as a reminder that risk isn't always visible or modifiable through diet and exercise alone. While lifestyle factors play a crucial role in heart health, genetics can sometimes override them. Recognizing this is not discouraging, it's empowering. With knowledge comes opportunity, early detection, better monitoring, and new therapies tailored to those most at risk. For people with a family history of heart disease or stroke, asking a doctor about LPA testing could be one of the most important steps they take for their long-term health. Overall, this study represents a hopeful leap forward in cardiovascular science. It highlights the value of global collaboration, the importance of genetic research in medicine, and the exciting horizon of targeted prevention strategies. While elevated LPA levels still pose a serious health challenge, the progress made in understanding its impact across different ancestries is cause for optimism. With the right tools, the right research, and the right public health initiatives, We are increasingly well equipped to meet that challenge and turn knowledge into action that saves lives.